Hi, I'm EJ Park from ZeptoMed. I'm sure almost everyone in this room must have family members or friends who are suffering from lifelong and debilitating hypertension and/or diabetes. Among those who are diagnosed and treated with medication, a significant number of patients still cannot control their blood pressure and their blood sugar level. Hence, their long-term outcomes are much worse than those who are controlled. One of the main mechanisms for exacerbating hypertension and diabetes is chronically and abnormally high sympathetic activation between the brain and then corresponding end organs such as the kidney, liver, and pancreas. Therefore, we are developing a catheter system that blocks sympathetic activities between the brain and the corresponding end organs using radiofrequency energy. The system consists of a catheter and a generator. The catheter is one-time use, hence should be discarded after the one-time procedure, and the generator is a capital item. The system ablates the sympathetic nerves around the renal arteries for hypertension and the hepatic arteries for diabetes. This in turn lowers blood pressure and blood sugar levels. I would like to use a simple analogy with medications. I call this approach an electrical sympathetic blockade. However, unlike medications, the procedure is one-time, delivered locally, and the effect is permanent. The patent-pending ZeptoMed design focuses on improving efficacy, which the current radiofrequency devices in the market lack a little. We will surely improve the efficacy with the thinnest and most flexible catheter that reaches the target locations the fastest and safest while maintaining optimal contact force during radiofrequency energy delivery. Hypertension and diabetes eventually cause many cardiac complications. Many of these patients end up in the cardiac cath lab because of their cardiac complications. They are our first target population. Interventional cardiologists can do sympathetic denervation for them without further referral. Medtronic has estimated the hypertension market alone could be as big as $3 billion by 2030. As you can see from this table, the ZeptoMed system will be the thinnest and most flexible catheter with optimal contact force. This will ensure more efficient, safer, and faster denervation over any competitors in hypertension space. I would say the same over the competitions in diabetic space. The same ZeptoMed system can be used for hepatic denervation for diabetic patients, which is a great advantage. In 4 years, we will complete the first-in-human studies for hypertension and diabetes and launch the approval studies in Europe and the US. At that time, we will be a strong M&A candidate for global companies. I have been working in the area of implantable and interventional cardiac devices for over 28 years in both global and startup companies. Sympathetic denervations for metabolic disease treatment has been my long-term endeavor. These qualified team members have worked with me for more than 10 years in renal denervation efforts, from clinical and regulatory to development and manufacturing. This time, we have teamed up again, not only for hypertension, but also diabetic treatment. Our clinical advisory members have been very prolific in clinical studies. They were the key contributors for recent FDA approvals for Medtronic and Rico Medical's renal denervation systems. They also are a part of the expert group developing the clinical guidelines for renal denervation for hypertension, and I'm sure they will do the same for hepatic denervation for diabetes. In summary, there are about 500 million uncontrolled hypertension and type 2D patients around the world. My team will develop the prototype and complete bench testing in 1 year, and the prototype will be ready for preclinical evaluation. Thank you so much for your time and attention.